President Trump said he will permanently cut funding to the WHO if it doesn't make, quote, substantive improvements to its pandemic response over the next 30 days. He also threatened to revoke the United States membership in the organization. Dr. David Nabarro is the special envoy of the WHO Director General on COVID-19. CBS News Pamela Falk spoke with him about his message to President Trump on the importance of the organization during a pandemic.
What's the overview of why the world needs a WHO?
By any judgment, this organization is extraordinary. It focuses on the inequities and inequalities in health between poor and rich, like no other body in the world. It is the meeting place of all the people who are working on health all over the world. It sets the standards on nutrition, on non-communicable diseases, on everything to do with environmental health. Every area of health, the WHO sets the standards. It maintains the numbers. It tells us who's dying of what. It sets up programs to improve malaria, children's health, women's health, road accidents, patient safety. You name it, they do it. Because each year, the bosses, the World Health Assembly, gives them more work to do. Suddenly, in the middle of this massive crisis, they get told that the major stakeholder thinks they've messed up, and so he's going to take the money away. But you know, there's something amazing about WHO. It's always benefited from US brilliance, US technical staff, US supporters, and of course, US finance. All my time in WHO, we had Americans doing the malaria work when I was doing the malaria program, really supporting all the work we did on pandemic preparedness. We do it all the time. We benefit from this relationship with the United States. We always have. So it's kind of bizarre that suddenly this country that's been really big in WHO has decided that it's going to cut the budget. I don't understand it. It just doesn't make sense. It doesn't add up. Right in the middle of something that's affecting 7.8 billion people. You know, it's kind of, if you explained it to anybody else, especially given the support that's always been there from the people of the United States to WHO, they just couldn't understand it. And sometimes it feels like a bad dream. And for staff inside the organization, they feel dumbfounded. They're doing the best. They're working with, there are Americans in there, many. And they're doing such good work, they can't understand it. So that's my question, could somebody explain to me why? Really, why? Why take the fire engines away in the middle of fighting a fire?